to use a combination of things.
Right. So you talked a little bit about cycling on and off. So which of these can you take all the time? Which of these do you need to break up and cycle? And what would you cycle in between?
I mean, ideally, it's good to cycle all of them. One of the
So
ones that
like, well, go ahead.
one, one of the ones that you can be on like more longer term is definitely like microdosing the GLP. Like that's one that you can be on like continuously. You can choose to cycle that one or not. Again, it just depends on like how you feel. But all the other ones, the BPC, GHK, Samoralin, NAD, glutathione. I like to cycle all those. I'm typically on those for anywhere from 8 to 12 weeks, and then I'm off for about 8 weeks together. And again, there's different ways to combine those. BPC TB 500 plus the Samoralin. It's an awesome combination. It's a great like athletic combination, recovery combination, hormone profile combination, because again, your body's going to release and produce more growth hormone with the Samorelin, and then you have more growth hormone receptors with the BPC 157. So it's going to amplify that effect. So you're going to get all the benefits of the growth hormone, plus all the benefit recoveries of that TB and BPC 157. And then you can also pair BPC and TB with the GHKCU to enhance overall wound healing. That's going to enhance like the wound healing production. So again, we're thinking like injury, we can do that. But then also the growth hormone helps with injury too. So it's like there's so much overlap. But then you can also pair the GHKCU with the Cimarelin, because that's going to help with the collagen production as well too. So again, there's 100 different ways to combine these. And just think of like what your goals are. So the way I would do it, all right, this is how I would do it. I'm gonna give you guys like an example stack. Example stack for me, where I'm at. Let's say I'm microdosing the GLPs, and then I'm gonna do the growth hormone secretagogue. And you know what? I got a little bonus at work, so I'm gonna do the BPC and the TB 500. So I'm gonna do those ones. I'm gonna run those ones for about, let's say, 12 weeks. Then I'm going to cycle off BPC. I'm going to cycle off the growth hormone secretagogue. I'm going to add the GHKCU and the glutathione. So then I'm going to run those ones for about 8 weeks. Then after that, I'm going to go back to BPC and the growth hormone secretagogue, because like I love the way I feel on those ones. Like I feel amazing. My lifts are awesome. My body composition is great. My energy levels are great. My sleep is great. I feel awesome. Run that again for 12 weeks. Come off. Maybe I'll do glutathione and NAD this time. I won't do the GHKCU. Take a break from GHKCU and I'll run NAD. So like that's how you can kind of like think about it. So you're always going to have like your main stack that you go back to, and then you can insert anything in between like your main stack. So like don't overthink it. Pick like one stack that you really like and do well with, and then just insert something different in between like your main stack. And then maybe after you do it for a while, you have two main stacks that you like switching back and forth, and you like doing that. So try to make it as simple as possible for you, and don't think that you're missing out on something because you're not doing it optimal. I think people overthink it a little bit too much. They're like, oh, we got this one now, so I need to do this one and this one and this one and this one. Like, what do I do with that? And it's like, don't worry, you know, doing a lot of great job with just adding in these simple ones. Again, BPC TB 500, the growth hormone secretagogue. I put almost like everyone on that to begin with, because it gets rid of so many issues. So again, to me, that's like my foundational stack right there, plus the GLPs most time. That's like my foundational stack. Then I'm rotating other stuff in there. I'm rotating other immune system ones, other mitochondria ones, other detoxification ones. It just depends on like what I'm doing. But doing it more systematically like that, you see progressions each time. So the first time that I ran that Samoralin BPC, I saw a certain progression, took a break, and then I see another progression, and then take a break, and then I see another progression. So it's like you're continuing to progress and you're not really ever plateauing. And then it keeps it simple so you can allow your brain to have bandwidth to do other things. Because this is what you're going to realize is as you begin to improve these systems in your body, you're going to want to do other stuff. You're going to want to pick up other hobbies that you used to do, other business adventures maybe that you want to do, other creative endeavors that you want to do because your body feels better. You used to have this old Prius that's broken down, and now you upgraded to like a Ferrari. So you're like, man, I want to do some drag racing now. Like your ability to experience life is on a whole new level. So again, if you could in your mind where your protocol is simple and you're not worrying and stressing about it so much, that's going to give you more bandwidth to enjoy life, which is really the goal of what we're trying to do because we're trying to increase cellular efficiency, cellular function. We're trying to increase that resiliency. So it's like you're going to want to get out and enjoy life more, actually. And that's where you
Yeah.
should be, or more your focus should be, not being like, am I optimizing my peptide protocol?
Right.
Yeah,
Right. Definitely want to see the results.
exactly.
So a lady came in and asked, the BPC, she said, is helping her severe IBS, which we know that it helps with gut health. But she
Mhm.
says she's feeling more soreness after her weightlifting. And I know that you had mentioned before that that you had a client come in that was on the BPC and he said he was still hurting, and you're like, well, are you lifting more?
I
Like,
lift it more frequently because you're feeling
yes.
better. Yes,
Yeah.
that is, yes. These peptides are great, but they don't eliminate pain. If you still work beyond the muscle's ability to recover, you're still gonna feel pain. That's the thing. Again, we're improving a lot of systems, so you're gonna feel better. You're gonna work out more often. You're gonna work out more intensely. You're gonna lift heavier weights. So you're gonna push yourself harder. So again, like this is where you have to be aware of how hard you're pushing yourself and maybe pull back a little bit if you are feeling sore after the gym still, because these don't make you invincible to being sore. You're still going to be sore if you're lifting beyond your body's capacity.
So just more of a quicker recovery, hopefully.
More of a quicker recovery, yeah, for sure, for sure. But again, if you're still pushing it beyond, if you're still overtraining and you're not properly fueling yourself, again, the peptides are great, but they're not magic. They help improve a lot of the lifestyle decisions that we make. You still want to make good decisions. You still want to do proper training with proper intensity, and you want to make sure that you're still recovering and refueling your body as well too. So that's that's like it's like a catch 22. You feel better, you want to do more, but still push it within a certain limit because there are limitations to matter. Like we're still not superhuman yet.
Okay, so going back, I know the GHKCU, you said it's good for immune health. I have two questions I think that are going to address this. So, autoimmune diseases, what is that one or the glutathione, like Samorlin, like what is best for those who have autoimmune issues?
So my autoimmune cases have done well best with like the BPC and the TV500, like as like
Okay.
their foundation stack. That's the best for my autoimmune cases. Now, again, everyone's different, so it doesn't hurt to throw in like a glutathione. It doesn't hurt to throw in a Samorlin. It doesn't hurt to throw in microdosing of the GLPs even because those are huge with autoimmune as well too. So the first two places I would start if I was starting is the microdosing of the GLPs and the BPC and the TV500. That would be my base. And then from there, experiment from other things from that part. But that's the base of calming down that immune system function.
Okay. And then with the GHK, we know that it will help increase your hair growth. So
Mhm.
for women, does that include facial hair?
That's okay. All right. order for you to grow facial hair, you have to have more androgen receptors. It does not increase more androgen receptors in the body. It actually acts as like an anti-DHT converter, which can lead to undesired hair growth in people. So it actually will cause less facial growth on the
Ah,
face and then more hair growth on the hair because it's increasing the hair follicles. Again, we're balancing the body with these things. It's not causing unrampant growth of things that you don't desire to happen. It's not like you're taking an anabolic steroid where you can get undesired side effects with that. Where again, when you hop on anabolic steroids, yeah, they're going to get more virilization, they're going to get more masculinization, they're going to get the deeper voice, they're going to get hair on their face, all sorts of different signs and symptoms of that. But again, with the peptides, I I mean, I'm surprised no one else has asked me that question. That's actually a really funny question that you asked me. But no, it's true that people think about that. But yeah, it will not cause more hair density on the face. It focuses on the scalp, improving the collagen production on the face. Yeah, yeah.
okay, that's awesome.
Hair is a complicated issue too, because you got to understand the etiology. So don't think if you just take the copper-based peptide, that's the only thing that you're going to do, because a lot of what has to deal with hair is the thyroid. Thyroid plays a huge role in hair growth. Also, viral infections. Viral infections play a huge role in hair growth as well too. So if you
So
have
like
like
they decrease it?
they can decrease it. Yeah. So that's where, again, because the GHK is also antiviral, it's super, super great for the hair growth as well, too, because not only is it increasing stem cells, but it's antiviral. And again, maybe you need that VPC TB500 to balance more of that immune system dysfunction. And then when you balance the immune system dysfunction, it can help fight the virus more or any type of bacterial function in your body to help with the hair growth. So again, outside appearance is always just a reflection of something inside going on. So don't think of just treating things from outside. Think of treating things inside out. Gut first, foundation. We have to treat the gut first because that opens up your system to everything else. So if there's any like gut dysbiosis, any infection, any overgrowth, any leaky gut, we got to deal with that first, seal that up, and then everything else can fix itself from there.
Okay. Um, there was another question about trimmers, essential trimmers. Do we offer a peptide that might would help with that? That no,
I
that's one I threw on you. Like I didn't.
Yeah, again, I'm not saying it can or it can't, because again, we're treating systems. So if you take someone through a comprehensive program where we're cycling through a majority of these different peptides, we're improving all these systems. I don't see why not that symptom cannot improve, or at least start to see some sort of improvement within it. I mean, yeah, again, I would probably start with the microdosing of the GLP and again that BPC and TB500. When I'm thinking tremors, I'm automatically going to like BPC and TB500 just because the way it works on the nervous system and the way it helps with nerve regeneration. But I feel like there might be like a deeper issue of how long it's going on. So I would add like that GHK. And then the last one I would probably do is that glutathione to help those detox pathways, because there's something in the system that's like blocking it. So if there is unresolved healing or unresolved symptoms that are taking place, I usually think that something's blocked and the body's having a hard time detoxifying. Because think about it this way, if you get a cut on your hand, what's going to happen? The body's going to naturally heal that cut. But if it doesn't heal it, there's usually like an infection in there. There could be rubble. There could be a thorn. There could be something blocking the body's ability to heal that cut. So it's like, it's not about adding more. It's like, I don't need to put like more disinfectant in it. I don't need to put more this in it. I need to remove the stuff that's there that's stopping the body from healing. So glutathione, the body's master antioxidant and detoxifier, that's going to help flush a lot of things out of the system. So if we can flush a lot of things out of the system, we take a lot of the burden off. we allow the body's natural healing abilities to thrive because that was maybe blocked. So that's where that's like kind of how I'm like troubleshooting with these. I'm like, all right, do I need to support the nervous system? Do I need to support musculoskeletal? Do I need to improve the healing process? All right, is there these not resolving? Is there something blocking this? Because it's not resolving because I'm giving them what they need. All
Yeah.
right, we'll go to this. All right, we're improving. Okay, we're improving. How can I amplify this a little bit? Because we're getting there, but it's like we're not quite over. It's like I pushed it up the hill, but I haven't quite got it over. All right, let me add the Samoralin because that's going to amplify the effects of the BPC and the TV500. All right, so I just need to get them like a little bit more over that hill, and then that could be it right there. So it's like you're slowly working people through these processes.
Right. And I don't think a lot of people want to take time to do that. They're like, hey, so like a cycle of these, do you normally, I know it depends on how long you've had the issues or what the depth of um, the, what word am I looking for? The decrease in the body, like what you're
Mhm.
missing.
Mhm.
Um, do usually you feel something different like pretty quickly after being on these peptides?
Yeah, like I said, I mean, I put that guy on that GHK, BPC, and TB500, and literally within 5 days, he was calling me and saying he was feeling better.
Yeah.
I don't always expect that, especially like with a long-term injury. Sometimes expect to do a minimum of like 3 to 4 cycles of it. You know, I had a chronic ankle injury that was like 10 years old, started to develop arthritis in the joint right at like that talus, which is like that ankle joint.
Hmm.
I could barely walk. Like, could not like flex the foot. I did BPC TB500 4 or 5 times and pretty much resolved now. But it took, again, depending on how long the issue is, how severe the injury is, definitely like expect like for full resolution 3 or 4 times, but you can start to feel better like pretty fast. You'll see the swelling go down, you'll get more movement. But again, for that whole tissue restructure process, it takes time for the body to lay down new tissue, to build up new cartilage, to build up new ligaments. So like that's where the process takes time. But yeah,
Right.
people can like start feeling better like within a couple days. But
Yeah,
again,
that's
that's
crazy.
not the case. That's not everyone's case.
Right. Okay, let's go quickly into I say quickly, however much time you have. Hormonal balance and maybe like that plus libido with perimenopausal, postmenopausal like women.
So there's 2 ways that you can do this. A lot of times, again, it's all that insulin insensitivity that where a lot of the hormone dysfunction starts. So because we lose that insulin sensitivity, our body is not producing the proper amount of hormones because it's not knowing how to handle glucose. What's causing all these downstream effects, down regulation of the hormones. So again, first place I would start with regulating of hormones is microdosing of that GLP and then adding in that growth hormone secretagogue because we want to naturalize and improve the function of that growth hormone. By improving that, we start to improve the whole hormone profile. And let's say, a woman, after you do that, symptoms are not fully resolved, but what we've done is we've increased the cellular efficiency of the body. So now if they do need to go on like any sort of like HRT or hormone replacement, they're going to need less and their body's primed to actually like accept that, as opposed to just taking the car in, not doing any prep work, and then trying to put this super fuel in it. At least like you've done a lot of like engine repair, you fixed the exhaust system, you've done this. So it's like if they need to go on estrogen or progesterone, they're going to be able to go over lower dose and their body's going to be more primed to receive that so that they're going to resolve the symptoms and then they're going to run into less side effects because again, a lot of time the poison is always in the dose. So that's like where I would start with that. Microdosing the GLP, fixing the gut microbiome by that, improving insulin sensitivity, improving the hormone profile with the growth hormone. And then again, if they need any sort of like HRT, that's where I would go to next with like any like perimenopause patients.
So basically, everybody needs to be on a microdose of GLP-1 at
Great.
least.
In some ways, shape, or form. Yeah, I mean, again, these are becoming pervasive throughout the whole scene. I mean, whether again you're looking for the weight loss benefits, the longevity benefits, I mean, the bodybuilding community is jumping in on these GLPs as well too, and using them in their prep cycles, because they're very anabolic, and they also are super protective for these guys who are running these different types of like steroid cycles, that it actually like protects your organs even when you're running these steroid cycles, which is like, again, crazy.
Yeah,
So yeah, again, there's so many ways that you can take these GLPs. I mean, I don't really need them for the weight loss, but I like to do them for the longevity benefits. So I'll throw them in a cycle here every once in a while, because it's like I know the benefits of what it has. But again, if you look at the landscape of where America is and where the overall health of where everyone has some type of metabolic dysfunction. So it's very easy to say that, yes, everyone can benefit from a GLP. That's why this market is so huge. And that's why it's helping so many people, is because so many people have so much metabolic dysfunction because we've lived off the standard American diet, or the SAD diet, for the past 30 years, and it's wreaked havoc on our health and our metabolic function. So first, at that bottom of the pyramid is stabilizing that metabolic function again, restoring insulin sensitivity. Again, once we change these healthcare systems and we get society to embrace a level of health, maybe everyone won't need the GLPs anymore, because we've set like a new baseline. We've set like a new culture. It's like people are taking care of themselves. They're getting exercise. They're eating whole foods. They're getting natural sunlight. So it's like, but that's going to take time. But in the meantime, while we're in the trenches, I would say, a high majority of people could definitely benefit from GLPs, which is crazy. It's just like this one peptide is literally like changing the world.
that
It's
is crazy.
it's so crazy
And
to think about it.
it is. And people that just won't see the benefits of it, and that just amazes me too, that they're just so against it. Um,
Yeah, and
okay,
again, I was just gonna say, most people are doing it for like the weight loss, but again, it's even the people that don't see the weight loss right away, even if you do like pre and post blood work, it's still improving a lot of their panels on there. So again, it's still doing stuff under the surface.
right, right. Um, there was one more, I think I wanted mood and mental health. Okay. So which ones, so I'll just say this. I've been on the GLPs. I did some of the NAD, and I haven't taken any of this is just me personally. I was on antidepressants for about 5 years. I was on Prozac and Wellbutrin, and I haven't taken, and I tried to slowly wean myself off of them. I haven't taken either of them since like like the 1st of February, and I'm
Mhm.
feeling great. So, which ones of these? I know that some of them do help the mood, help improve but is that just based off of just better health? Like my body is just in a better place than it was?
Uh, yes. But also, too, depression is actually linked more to your body's inability to use glucose. Very simply right there. So again,
Okay.
what did you do with the GLPs? You're increasing your body's ability to handle glucose. We're increasing insulin sensitivity. We're increasing insulin sensitivity within the cell. We're improving brain function. We're improving brain function. We're improving mood. We're also improving the gut microbiome. And we're decreasing a lot of inflammation in the gut, because your gut is connected to your brain through the vagus nerve, which can improve your mood. And you're also producing a lot of serotonin in your gut as well too. So the GLPs has multiple compounding effects of why it is you're experiencing that better mood, and why you're not feeling like you have to take that depression medication, because we've increased your body's ability to handle glucose within the body and within the brain. So it's, again, we're increasing that metabolic flexibility. Your body needs to be able to use these fuels. You get depressed, depressed. It's pressing down because it's low energy. It's being depressed, low energy. You're being uplifted because your body can utilize the energy now. So that's why you're not feeling that. And we interpret it as a thought, but it's actually a fuel dysfunction that's going on within the body, which is leading to that thought.
Well, that makes a lot of sense. Like I
Yeah.
would have never put all that together, but I mean, yeah, because a lot of people that are depressed are usually overweight or, they just don't feel good, just all the things. I would have never matched insulin resistance with being depressed, but it makes total sense.
Yeah.
Total
It's
sense.
almost so simple, it's easy to overlook. Because
Yeah,
some cultures don't even have the word for depression.
right.
And yeah, because they don't know what that is because they eat all natural food and they're connected to the natural rhythms of the earth. And so it's like depression for them is like they don't even know what that is. Like,
Yeah,
and again, for us, we're seeing these huge rampant increases in depression within, the Western society. And again, there's multiple reasons for that. People are feeling less connected, they're feeling more lonely, they're feeling more isolated, they're feeling less sense of purpose. Like those are all definitely like things that we need to like address as well too. But again, at the base of the pyramid, if you can improve that person's ability for metabolic flexibility and get them to like feel better, they're going to start making better choices. If you feel better, you don't mind being around people. If you feel crappy, because you have that insulin insensitivity and your body doesn't have that metabolic flexibility, you don't want to be around people because you just feel drained. Like your
right,
band is not there. You can't handle stress in the same way. You can't handle when life throws you hard times. You can't handle when you have to get and go to activities and commit to all these things. But if you can improve again at the base that metabolism, make your body robust and resilient, then it's like you can handle more stress, you can handle more activities, you like being social, you like being with people because like you yourself feel good first.
right. That's great. I don't guess I've heard that from that perspective. That's great. Okay, I have a few questions that were specific that I want to go over, that I just want to ask real quick, and then we'll get. It says, "What's the best peptide for wound healing? Wounds have been present for 2 years, improving. They improve and decline in cycles. Deep tissue injury versus maybe a diabetic wound. This patient also does have diabetes, MDS, frequent blood transfusions, chronic kidney failure, history of dialysis, post-COVID, CHF. What is the best peptide, or would there even be a good option for this person?"
Uh, I would start them on the GLPs and that BPC 157 for a while and run them on that like for a while and then throw in the glutathione in between, like when they're going in between cycles. But you're gonna have to put this on this at least 3 or 4 times back and forth, where it's like GLP, BPC, TB 500, glutathione, and then BPC, TB 500, GLP, and then glutathione. I would just like keep switching back and forth because there's just like a lot of chaos going on inside that person's body.
Yeah. Um,
And that's going to
okay.
go away a lot of the layers, everywhere from like kidney function to liver function to cardiovascular function, getting rid of the inflammation and allowing the system to like calm down and actually heal.
Yeah.
And I got about
Um,
10 more minutes free. So
okay, perfect. Real quick. 73-year-old woman with COPD, minor cognitive issues, but otherwise healthy. She's on the lowest dose of semaglutide and NAD. If we were to rotate in other things, what would be the next go-to?
yeah, I mean COPD cases, I would definitely throw in that BPC TB 500 because it's a muscle still too.
Yeah. What is a peptide that could help with lymphocytic colitis?
Lymphocytic colitis. Uh, I would probably go with the combination of the BPC TB 500 and then also that growth hormone secretagogue. That's any type of like lymph issue. So the lymph system, it's different from the cardiovascular system in that it needs movement to pump itself. as opposed to the cardiovascular system that the heart pumps it to keep your circulatory movement is what keeps the lymphatic system going. So if we're having static lymph, your lymph nodes has to deal a lot with your immune system. So that person is going to have extra inflammation and immune system dysfunction. So we want to add in that BPC and that TB500 to balance the immune system and bring down some inflammation and deal with the disease tissue that could be causing from the stagnant lymph. Then we want to add in that growth hormone secretagogue because they're going to need to move. They're going to need to start putting on some lean muscle mass because that's going to help muscle movement gets the lymphatic system moving. That's
Okay.
super important for your lymphatic system. Yeah.
Okay. And then last one, someone has a history of thrombocytopenia, has a blood clot, and is on impacts, I guess, a blood thinner. She really wants to try a GLP. Primary Med doesn't have enough information or education on peptides. Would she be able to try a GLP?
Yeah, I mean, low dose, she would be fine. I would just start them on a very low dose, any type of patient like that. I would even maybe like microdose them for the first 2 or 3 months, even just to see again how their body responds. Again, we're always going for the lowest effective dose with these things. So someone with that types of issues, who a physician is kind of like on the fence, doesn't know enough information, I would recommend a low dose 2 to 3 months and then kind of like reevaluate their labs and kind of see where they're at.
So any kind of clotting disorder or somebody that has a history of clots, you need to just, is GLP-1 something that
I would
any of
give
them you need to be wary with?
I mean, I'm not worried about the clotting disorder. I'm worried about like why her blood is clotting. So again,
Okay.
I just want to focus on improving the system first. I don't want to so much focus on I don't want to treat this patient like we can't touch them because they have a clot disorder, because just as much as the body creates something, the body can reverse it and break it down. So that's where, again, I would start with those GLPs because again, at the bottom of the period, it's metabolic dysfunction. So if we start with addressing that first for the first 2 to 3 months, maybe some of those blood clotting factors could have improved. I don't know. I mean, I've
Yeah,
personally seen that, but again, it's going to help other things improve and help with that flexibility. So if there is something going on, that's where I would start with. Ever a complicated case, I'm always starting on the lower dose of something.
okay. Well, I think that was all I had. Thank
Sure.
you so much for your time. This has been like I've listened to you a lot of times, but there's just always so much more that you just offer in every conversation.
I feel
So
like I do the same thing over and over. I'm so bored listening to myself. But I'm glad you guys are getting value out of it.
I know, but yes, it's wonderful. It's wonderful for us. So we definitely need this. But I appreciate it. Thank you so much for your time.
Yeah.
And I hope to see you again soon. Maybe I won't bother you too much though.
No,
But
you guys are good. Just if you guys have any questions, just let me know because I know this space can be confusing. And it's like the more I keep going over the foundational principles and examples for you guys, the more it's gonna click. And eventually you're gonna get to this point of excellence where it clicks and you just know it. But until we get that point, this is a very much important thing that needs to happen because so many people are so misinformed or uninformed about these. So it's the more that we can educate, help people to grasp the understanding, learn about these. That's how we really change this space. It's not just getting access to these medications, but it's the education behind it as well as like the equipping that's super important as well too. So this is just important as anything else. So if you guys have questions, I mean, just let me know because this is like where a lot of the real change happens.
absolutely, absolutely. And that's what I keep trying to like. I'm just like, I just want y'all to know about these. I want you to know what they do. I want you to know how they work. And so because I am really passionate about these. I believe in them, and so and I
Yeah.
can tell you do too. So all right. Well, thank you so much for your time.
Thank
And I
you.
look forward to seeing you soon.
All
All
right.
right.
Take care. Y'all enjoy your weekend.
All right, you too.
Bye.
Bye.